Hi, my name is Andrea Brower, and this is my internship project presentation for Public Health 497 of Fall 2020. I completed my internship at Brigade Boys and Girls Club here in Wilmington. Brigade is a nonprofit organization who serves members in kindergarten through the 12th grade. They're funded by foundation, corporate, and government grants, and they also receive donations from individuals as well as other sponsors. They're founded in 1896 by 5 boys and have grown to become what they are today, serving over 2,200 members in New Hanover County, Pender County, and Onslow County. Their mission is to inspire and through character development, enable all young people, especially those who need them the most, to reach their full potential. They do this through programs that are developed in 6 core areas, including character and leadership development, career development, education, health and lifestyle skills, arts, and sports and recreation. So for my internship, I served in Brigade's Youth Center, who serves members in kindergarten through the 5th grade. For their morning enrichment program, I was a remote learning youth development professional, or a RLYDP. This program was a newly implemented program following New Hanover County's decision to go 100% remote for the first 9 weeks of the school year. So Brigade aimed to provide a school-like setting for their members to come complete their schoolwork and remain on track academically. This is really important because a lot of their members are 2 to 3 levels behind academically and require an individualized educational program or an IEP. I also served as a YDP, or a youth development professional, for the afternoon program. This program mainly consisted of program planning and implementation. There were 2 programs in our youth center, including Healthy Habits and Smart Moves. Healthy Habits focus on promoting nutrition, physical activity, and overall well-being, while Smart Moves was more of a prevention program discussing drug and alcohol use as well as community safety. We also had to ensure that each of our members were following CDC's recommended guidelines, including wearing a mask, washing their hands, and cleaning areas as they left them. Some other responsibilities I had was planning, leading, monitoring, and evaluating programs. As I mentioned, Healthy Habits and Smart Moves were the 2 programs in our afternoon session. So these were pre-planned programs, but we had the freedom to alter them as we seen fit, depending on the particular members in our groups. So I was responsible for 2nd to 3rd grade girls. I quickly learned that my girls did not like to just sit and be lectured, so I had to incorporate some creative hands-on activities for them to really be engaged and really retain the information that was given. I also had to provide behavioral guidance and role modeling. Most of the members really look up to us, so if we come in with a negative attitude, they're really going to reflect on that. So it was really important for us to remain positive while we were working there. I also had to promote engagement in programs and activities. As mentioned, I had to engage my members in Healthy Habits and Smart Moves, but I also had to engage them during our morning enrichment program. Most of the members were used to coming to Brigade during the afternoon program, so they weren't used to sitting in one area doing schoolwork. So sometimes it was hard for them to focus, so we had to find ways to keep them engaged and keep them doing their schoolwork and attending their Zoom meetings. And I also work with staff to develop plans for program improvements and alterations. As mentioned, the morning program was a new program for all of us. Our supervisors, our directors, none of them had ever done this before. So we had a lot of morning meetings to talk about what we needed to do moving forward and what we needed to do to improve in order to reach our goals. For my project, I decided to do a COVID-19 lesson plan. I taught the basic terminology on communicable diseases and gave an understanding on how these diseases are spread, such as, well, I really focus on airborne diseases. And then I discuss some of the preventative methods that CDC has set in place following COVID that help decrease the risk of infection. As mentioned, my members really like hands-on activities, so I included 2 activities to give them a visual representation on how these methods are effective. My first activity was a hand washing representation. I actually got the idea offline, but I altered it to fit my lesson plan. I named it Disappearing Germs. So the way this activity worked was members had to draw and color images of germs on a blank piece of paper. They then put it in a Ziploc bag and trace their hand on the outside of the bag. We got a clear container and put water in it. And when they dipped it into the water, it gave the illusion of the germs disappearing. I actually have a short clip on this. We broke our original container, so this one wasn't quite deep enough, but you can still get the idea. As you can see, the germ disappears, and when she pulls it out, it reappears. So my second activity was a mask activity that I actually created. I wanted to show them why it's important to wear a mask and how it prevents the spread of viruses and diseases. So this included 2 spray bottles, one with a mask and one without a mask, and both of the spray bottles had food coloring in it. We laid a white piece of paper on the floor, and both bottles were sprayed to see how far the water traveled onto the paper. Most of the members thought that the bottle with the mask, the water would travel at least halfway across the paper, but it did not. I do have a short video on this as well. So as you can see, she's spraying it. It's not going through the mask, it's dripping underneath the mask, but it did not go through the mask. So this is very shocking to my members. So it really showed them why we stress them wearing a mask and wearing it properly, not wearing it below their nose or on their chin. My internship followed the CEPH Public Health Domains under project implementation. As I mentioned, our afternoon program involved us planning lessons weekly. We also had to evaluate healthy habits and smart moves. It also falls under human health. My project was promoting health as well as health protection and the determinants of health, behavioral factors, impacts on human health. It also followed some of the NCHEC CHES competencies under Area 3, Implement Health Education / Promotion. So as I mentioned, the morning program was a new program, so I was involved in the delivery of a health promotion plan. I also was involved in the modification plan to ensure that it was consistent and was able to reach the goals that we originally set for the program. My internship also fell under Area 4, Conduct Evaluation and Research relating to health education / promotion. I created my own evaluation of our morning program, so I was required to pick an evaluation model, develop an instrument, as well as interpret and analyze the results. Overall, my experience with Brigade was beyond amazing. I learned a lot of things. The main thing I learned was everything that is involved with allowing an organization such as Brigade to run successfully. I watched our key leaders, such as our CEO, our supervisor, our directors, handle funding and sponsors. And then I really paid attention to our program coordinator. She was really amazing. She put a lot of time and effort into each and every program and ensured that we each had everything that we needed. So I just really learned that teamwork is really important in this. The thing that I liked the least about Brigade was how unorganized it was in the beginning, which I know it wasn't their fault, but it became really stressful at times to keep up and try to adjust to all the changes. The thing I like the most about Brigade is by far my members. I loved each and every member. Just being able to be a part of their lives and impact them in some way is just really fulfilling to me. So I wouldn't change my internship experience for anything. I think Brigade was right where I needed to be.